Good afternoon. My name is Bill Webb, and I'm the Executive Director of the Congressional Fire Services Institute, a nonprofit organization designed in part to bring national fire service organizations to the table and develop unified messages that our organizations can collectively deliver on Capitol Hill about the needs and challenges of our nation's firefighters and emergency services personnel. Standing behind me are representatives of CFSI's National Advisory Committee, comprised of 38 national fire service organizations, who are here to demonstrate their support for passage of federal legislation to reauthorize the Assistance to Firefighters Grant program, the Staffing for Adequate Fire and Emergency Response Grant program, and the United States Fire Administration. These representatives represent our nation's fire chiefs, career and volunteer firefighters, codes and standards organizations, fire marshals, arson investigators, training academies, women in fire, accreditation agencies, the sprinkler industry, the fire service industry, and the families of our nation's fallen firefighters. AFG and SAFER and USFA are critical to ensuring that America's firefighters and EMS personnel have the equipment, training, and staffing levels they need to keep themselves and their communities safe. Firefighters and emergency services personnel respond to over 36 million emergency calls annually, including fire, medical emergencies, both man-made and natural disasters. They're on the front lines during the pandemic, the opioid crisis, placing themselves at great risk to save others. They're called first responders for a reason, because they never hesitate to respond when an emergency call is placed, regardless of the time of year or level of threat to their own health and safety. Congress first authorized the Assistance to Firefighters Grant program in 2000, 1 year before 9/11, to address the baseline needs of fire departments across the country. To this day, funds are used to purchase basic equipment such as turnout gear, self-contained breathing apparatus, portable communication systems, and personal location devices. These are essential pieces of equipment firefighters need to save lives, their own lives, and the lives of the citizens that they protect. And yet many fire departments still lack the necessary equipment and training to perform their mission safely and effectively. In 2004, Congress authorized the Staffing for Adequate Fire and Emergency Response Grant program in response to concerns over the adequacy of firefighter staffing in career and volunteer departments. These funds have been used by fire departments across the nation to increase the number of firefighters to help communities meet industry minimum standards. This is why we've urged Congress to continue their support of these grant programs in the United States Fire Administration, our lead federal agency and our voice at the federal policy level. I'm honored to share the podium with my esteemed colleagues from the other national fire organizations who will offer their own thoughts and perspective on why we call on Congress to reauthorize AFG, SAFER, and the United States Fire Administration. It's my pleasure to introduce our next speaker, Seth Statler, Director of Government Affairs for the National Fire Protection Association. Seth?
Thank you, Bill, and good afternoon. The National Fire Protection Association is a self-funded global nonprofit devoted to eliminating death, injury, and loss due to fire, electrical, and related death. At our core, at NFPA's core, we manage the development of more than 300 consensus codes and standards that influence every aspect of fire, life, and electrical safety. NFPA is proud to work together with many who champion safety. The United States Fire Administration is a vital partner. Their advocacy and their hands-on leadership training for firefighters from across this nation make a huge difference. Congress needs to reauthorize and fully fund this small but critical agency. At the same time, data from NFPA demonstrates how underprepared our nation's firefighters are and how important the federal grant programs are. Our most recent needs assessment of the U.S. Fire Service found that significant needs exist for departments of all sizes and in every area, including staffing, training and certification, facilities, apparatus, personal protective equipment or PPE, and health and wellness. In general, the smaller the community protected the greater the need. For example, the needs assessment found that nearly 2/3 of departments have firefighters wearing personal protective clothing that is 10 years or older. More than half of all fire departments cannot equip all of their on-duty emergency responders with self-contained breathing apparatus. Serious shortfalls were also identified with portable radios, with cleaning equipment for PPE, and even with wildland fire PPE. Despite the fact that an overwhelming majority of U.S. departments reported that they have some responsibility for wildland fires. Unfortunately, the list goes on and confirms the urgent need for continuing the Assistance Firefighters Grants, or AFG program. NFPA data also shows the pressing need for recruiting, retention, and firefighter health and safety programs that are key components of the staffing for adequate fire and emergency response, or SAFER. This week is Fire Prevention Week throughout our country. For 101 consecutive years, the President of the United States has joined with NFPA and all of the other fire service organizations in calling on all Americans to focus on fire safety. This week's theme is Cooking Safety Starts With You. Pay attention to fire prevention. There is no better time of year than Fire Prevention Week to thank our first responders and to pay attention to the significant needs of America's fire service. And so NFPA joins with our sister organizations in calling on Congress to complete work on the reauthorization of the Fire Administration, AFG, and SAFER as soon as possible. Every 23 seconds, a fire department in the United States responds to a fire somewhere here in the nation. It was almost inevitable that it would happen during the press conference here. And a home fire occurs every 93 seconds in this country. The number of calls is rising at the same time that recruitment faces serious challenges. This bipartisan legislation is an important step towards ensuring that our volunteer and our career firefighters have the equipment and other resources to protect their fellow citizens. Thank you. Our next speaker is my friend, Chief John Butler, the President of the International Association of Firefighters. Of Fire Chiefs.
The AFG and SAFER grant programs are lifelines for our fire departments across the country. Thank you for joining us today. I am Fire Chief John Butler of the Fairfax County, Virginia Fire and Rescue Department, as well as the International Association of Fire Chiefs President and Chairman of. I'm here to discuss the critical role that AFG and SAFER play in supporting our fire departments nationwide. Fire departments provide response to all types of emergencies, as you know. Fire, EMS, active violence incidents, wildfires, hurricanes, hazmat incidents, technical rescues, and other types of disasters. However, we face critical needs, especially because of the COVID-19 pandemic. Fire and EMS departments facing staffing, recruitment and retention challenges nationwide, and the supply chain problems increase the cost of fire apparatus and equipment by sometimes 20 to 25%. The delivery time for Type 1 fire apparatus was 9 to 14 months. That period has now almost doubled, sometimes 25 to 28 months, and in some cases even longer. Fire departments are suffering. They're also suffering from shortages in basic equipment and requirements. Consider following examples from the National Fire Protection Association Fifth Needs Assessment of the U.S. Fire Service. More than half of fire departments have unmet needs in structural firefighting gear, as we've already heard. Only half of all fire departments can equip on-duty first responders with portable radios. Nearly 2/3 of fire departments have firefighters wearing gear that's greater than 10 years old. Again, like was just already stated, 53% of all departments cannot equip firefighters on a ship with self-contained breathing apparatus. AFG and SAFER programs provide funding to help fire departments meet these basic needs. Without these funds, we will struggle to maintain the level of service our communities rely on and expect. We need Congress to pass Fire Grants and the Safety Act to preserve these programs. So thank you. Our next speaker is Chief Kevin Quinn of the National Volunteer Fire Council. Thank you.
As Chief Butler said, I'm Kevin Quinn. I'm representing the National Volunteer Fire Council. And I'm honored to be here today with this critical message. We're just coming off the United States Fire Administrators Summit. And during that summit, I heard from the state of science and a number of other presentations about the effects and the positive results and outcomes of the FEMA, AFG, and SAFER grants. And it just leaves me, just billowing a little bit, because now here we're faced with fighting to make sure that we can get things done and make it right. Volunteer fire service make up 2/3 of the nation's fire and EMS and rescue services. AFG and SAFER grants are essential for the survival of many volunteer fire departments throughout this entire country. Without these grants, many volunteer departments would not exist. What if you called 911 and no one showed up? 67% of this country relies on the AFG SAFER. According to the NFPA, 98% of departments serving populations of less than 2,500 people are either all volunteer or mostly volunteer. This afternoon, my colleagues referenced the inability of many departments to equip their firefighters with the most essential equipment, like SCBA and turnout gear. This in particular is so true of volunteer fire departments serving these small and rural communities. This is the primary economic reason, because fire protection services are funded at the local levy tax base. Rural tax bases often struggle to find essential funding for firefighting equipment, like turnout gear and self-contained breathing apparatus, which cost thousands of dollars. These departments often fundraise with food drives and pancake breakfasts, but even those efforts combined with local tax dollars cannot provide the needed essential funding. AFG grants are critical to provide the additional need for needed funding for these communities, and the need is strong. AFG and SAFER, which often can only provide approximately 20% of the funded requested. 80% go unfunded. When it comes to SAFER, this afternoon my colleagues mentioned the increase in the volume of calls for service. The increased call volume has been coupled with the number of volunteer firefighters has dropped by 12% nationwide from 2010 to 2020. Additionally, since 2000, the percentage of firefighters over the age of 50 serving in communities with a population of 2,500 or fewer residents has surged from 18.9% to a whopping 34%. We are an aging population in volunteer ranks. Some of the largest factors impacting recruitment and retention of firefighters and the transformation taking place across rural America, along with increased mental and physical fatigue. As jobs have in small towns and young people move to cities and the suburbs in search of work, there are fewer people available to volunteer as emergency responders. As call volumes have risen and the amount of training continues, it does affect this aging population. SAFER grants provide critical funding to organizations and fire departments to assist with recruitment and retention. The MVFC has received funding from our Make Me a Firefighter campaign to help local fire and EMS agencies recruit volunteer personnel. The Make Me a Firefighter campaign is a web-based tool that provides departments with information about how to establish a recruitment program, gives them the package and customized marketing materials, messaging, and outreach strategies, and often provides free access to post-volunteer position listings on their online portal. None of this will happen without AFG. To date, there are more than 16,000 users signed up on the campaign to make me a firefighter, representing more than 9,000 fire departments. More than 5,350 volunteer opportunities are listed, with nearly 34,000 applications that have been submitted through this portal. We cannot lose that. Otherwise, when you call 911 in those communities, no one will show up. SAFER needs to remain available to help fund additional successful recruiting tools like the firefighter to ensure that when someone calls for help, a firefighter will be there to answer. We cannot take that for granted. Thank you. This time I'd like to introduce David Hoagland from the International Association of Firefighters.
Good afternoon. My name is Dave Hoagland, and I'm the president of the District of Columbia Firefighters Association, Local 36 of the International Association of Firefighters. I'm proud to represent both Local 36 and the entire IAFF today. As you've heard from other speakers, the Assistant to Firefighters Grant and SAFER grant programs are the two largest forms of federal support for fire departments. Firefighters serve in a uniquely dangerous job. We routinely respond to inherently dangerous calls where lives are at risk. When seconds count, the public deserves to know that trained and prepared firefighters are standing ready. Studies repeatedly show that the safety for both the public and firefighters increases when we have engine and truck companies with at least 4 firefighters. The SAFER grant program is a vital step to ensuring our trucks are adequately staffed and our residents are protected. No jurisdiction should be forced to let 911 calls go unanswered or expect firefighters to respond to calls without the adequate number of firefighters on board their apparatus. It is also important to recognize that firefighters can't work without the tools, vehicles, and equipment we need. Since 2001, the AFG has helped firefighters and other first responders obtain critically needed equipment, protective gear, emergency vehicles, training, and other resources needed to protect the public and emergency personnel with fire and related hazards. Far too many firefighters around the nation are forced to make do with family trucks, antiquated safety equipment, and broken tools. Since 2016, the SAFER and AFG program have given the District of Columbia more than $10 million to ensure our residents are protected and that our firefighters have the staffing and tools needed. There are residents of Washington, D.C. alive today because a SAFER-funded firefighter or an AFG-funded truck responded to their call. This bill also includes funding for the U.S. Fire Administration. They are our biggest advocate in the federal government and fight relentlessly to help us stay safe on the job and protect the public from fires. Another important component of AFG's fire prevention and safety grants is that they fund critical research into firefighter cancer. On our job, we are surrounded by carcinogens. The number one killer of firefighters is cancer, and this research helps us protect ourselves from this dangerous hazard. Sadly, these advancements in staffing, equipment, research, and public service are at risk. The AFG and SAFER programs will close next year unless Congress acts. IAFF members in DC and across the nation are proud to answer our neighbors' calls. But if we're not there to answer the call, there's no alternative to 911. Congress's inability to reauthorize these programs directly jeopardizes the lives of firefighters and the public as a whole. It's time for Congress to pass the Fire Grants and Safety Act. I'm pleased to welcome our next speaker, Victor Stagnaro, CEO of the National Fallen Firefighters Foundation.
Good afternoon. I'm Victor Stagnaro, the Chief Executive Officer of the National Fallen Firefighters Foundation. My pleasure to join you here today to discuss the important reauthorization of the United States Fire Administration and the AFG and SAFER grants. President Hoagland just described some of the health challenges impacting the nation's fire service, such as cancer, cardiovascular disease, In addition to these challenges, mental health and wellness is a serious challenge facing the fire and emergency services. Many firefighters experience mental health issues, including post-traumatic stress due to exposure they suffer while delivering emergency services to their communities. In fact, recent studies have shown firefighters and rescue personnel develop PTSD at a similar rate to military service members returning from combat. Unfortunately, many local fire departments are undersourced and lack the peer support and counseling services necessary to address these very important and vital problems. There's a lack of culturally competent mental health and wellness specialists to assist firefighters, and local employee assistance programs are ill-equipped to assist first responders. Local fire departments and the national fire service organizations represented here today rely on these federal grants and partners and the United States Fire Administration to conduct programs addressing these unique challenges. This past May, we honored 144 firefighters who died in the line of duty serving their communities, just up the road in Emmitsburg, Maryland. 79 firefighters who died in 2022 and 65 who died in previous years. As of September 30th, the National Fallen Firefighters Foundation is aware of 100 reported firefighter fatalities this year. Our nation's firefighters put their lives at risk every day to protect our communities. The AFG and SAFER grants programs are vital to ensuring that our nation's fire departments have the staffing, the equipment, and resources they need to protect our community and keep our firefighters safe. It's imperative that Congress reauthorize these grant programs and the United States Fire Administration without delay. Thank you for being here. Now I'd like to bring back Bill Webb from the CFSI to bring us some concluding comments. Thank you, Bill.
As you've heard from our speakers, fire and EMS personnel face enormous challenges in performing their critical work. When a 911 call is placed, every community across the country relies on their firefighter and EMS personnel to respond regardless of the incident type. The AFG SAFER grant programs have had a tremendous positive impact in addressing the unmet needs of fire departments across the nation. Needs in terms of basic equipment, training, staffing, fire prevention, and safety programs, and research. The United States Fire Administration is the lead federal agency, as my speakers have alluded to, for our nation's firefighters and emergency service personnel, providing a leadership role in the areas of technology and research, training, data collection, public safety education. 39 national fire service organizations call on Congress to reauthorize AFG and SAFER grant programs in the United States Fire Administration. This is our 911 call to Congress. Thank you very much.